Can we at least draw this conclusion that the vaccines we have in India, understanding and fully appreciating that they perhaps have not gone through the testing rigor that has happened in the United States and in other parts of the world, that it offers protection against severe, moderate to severe disease? Can we at least give, have that sort of an assurance? Because it's very important as we get into, the next question, which is probably the reason why a lot of young people are really tuning in to this talk.
Okay, so that's kind of very clear. We have about 85% or higher protection against severe disease, hospitalization, if you've had the vaccine. In fact, one dose of vaccine, because that's what's happening right now, a lot of people are not able to get their second dose as well. Even one dose of vaccine provides reasonable protection against severe disease. Reasonable as in good protection. And 2 doses certainly that protection over 85%. So that's a given, even with the limited data that we have within the country. What's less clear, what I was talking about, is the potential for participating in transmission. Because from a public health perspective, both are important. One is the reason why we are doing this vaccination now could be for 2 reasons. One is to stop transmission, and the other one is to prevent severe disease. They're not necessarily the same thing. So what we do know is if you've had vaccines, you can be reasonably confident severe disease is an unlikely phenomenon. Not that it won't happen, it does happen, but it's limited. On the other hand, the jury is still out about how much this blocks transmission. Now that brings me to this initial question that you had about herd immunity. Can we attain herd immunity by using the vaccine? It will only work if people who receive the vaccine do not participate in transmission. Right? The only thing it does is prevent severe disease, but then I get the virus, I spread it to 20 other people. Then honestly, the vaccine is not going to create herd protection. So the entire premise of herd protection is that in some way, the people who have developed immunity will not participate in transmission. Okay, so that part is not yet clear. But what is clear is people who receive vaccine will be protected against this. Now, coming to the question that you are interested in, I mean, you just alluded to it, I'll wait for your question, but I just want to say, if at all there is a rationale for vaccinating young people, right, it revolves around this question, will it prevent transmission? Because this is a huge chunk of population. If we could vaccinate all of them and they don't participate in transmission, yes, we will accelerate towards herd protection. I'll go back and say, individual protection, we really need it for the elderly because there is unambiguous evidence that the risk is several log higher for the older people. That is, if you develop an infection, that you will die. Whereas for individual protection against severe disease, at this point, when vaccines are shot, I play my cards out first for you. It's the older people who need it. And equity is an important thing as far as vaccines are concerned.